Good morning. This is Steve Stites, Chief Medical Officer here at the University of Kansas Health System, broadcasting live with you from the Dulles Simons Family Studio. I know it looks like I just rolled out of bed. My shirt's half off. That's not true. Instead, today you're tuning into the gun show. Now, you ask why that could be the case, because I don't mean handguns or anything like that. I'm talking about my good friend and colleague, Dr. Hawkeye here, who's showing his guns.
No.
Okay. Actually, one of our staff, Anthony, dubbed it this morning because we're going to show you about getting flu shots, because we're going to get flu shots here in just a moment on our program. We're also joined by Dr. Alan Greiner, who's the medical officer for the Unified Government of the Public Health Department here in Kansas City, and Broderick Crawford, who's the president of New Bethel Church Community Development Corporation, and the chair of the KU Cancer Center Advisory Board. I've known Broderick since he was a wee little boy, at least back when he was an infectious disease nurse here a long time ago. And I said to him a minute ago, Broderick, you haven't aged at all. Yes, you have. As have I.
Indeed.
All right. Well, first, let's get about the business of getting the flu shots, because I don't have the same bicep structure that my friend here, Hawkeye, has. So I'm going to not show mine quite like he does, because it's really just a bone. And I'm going to get the flu shot because, folks, you got to get a flu shot. This is like the most important thing here in the midst of the pandemic. Go ahead and get it. I promise you it doesn't hurt. Okay, that's a lie. It hurts. Damn it. But you know what? It's the right thing to do. It keeps you safe. It keeps your family safe. It helps keep your community safe. And just like that, I've had a flu shot. It's the best.
And I'd like to say, last year we had, thanks to Annie Shelton in our pharmacy,
thank you.
We had 55,000 doses of flu vaccine. We had to actually send back 14,000 of those doses because they went unused, and we went longer into our vaccination process. We went through April as well because we had so many. So please come to the health system, get your flu vaccine. At this point, it looks like we have plenty.
Yeah, we want you to come get it because we know that's going to help keep you safe. There are already reports of patients who have both coronavirus and influenza at the same time. That's not a combination we want to see. Too early to talk about outcomes around that yet. But we are seeing reports of those, and that's something we don't want to see. And have we had influenza in Kansas and Missouri yet?
I keep looking, and the CDC website is a little bit delayed.
It is delayed, isn't it?
I guess
can't.
More than
where's
a little.
The map?
Yeah. They still have the 2019-2020 influenza season up there. So unless Alan, or the KDHE, I haven't seen that there has been.
I haven't seen any Kansas, or we haven't had any in Wyandotte. You certainly can get your flu shot at the health departments
Thanks
as well.
To Marcy, we appreciate you being here.
And this was Marcy's idea. She wanted to inflict pain on us while also sending her mission and her message of get your flu vaccine.
That's
stay
right.
healthy.
And Marcy, I have something
thank you
for
very much.
Wait, Marcy, before you leave, I've got to give you this, I think. It's my flu shot form.
Thank you, Dr.
I filled it out.
Occupational Health appreciates this. Have a great day.
Thank you.
You betcha. Thank you, Marcy. And thanks to Hawk and the ID team and the Infectious Disease Clinic for helping arrange us to get these flu shots on the air to help encourage you to stay safe, keep yourself safe, help keep your family safe, help keep your community safe. And get a flu shot. It's the best thing you can do.
And
So Hawk,
my kids are used to it now too, so they wait every fall and really understand that they have to get that.
okay, so I think I'm going to take my mask off now because that exposure in the close quarters is done, and we are more than 6 feet apart, and you can hear us better when we do that. And we want you to hear this because we got a really special program this morning. Hawkeye, how are we doing?
This probably won't work. Our numbers today are not the best.
You want me to help you with your jacket?
No, we'll just keep it off right now.
Idea.
It's a little bit wrinkly.
Yeah. Your shirt's a little wrinkled. Did you iron it today?
What?
Did you iron it?
No, I didn't iron it.
Okay, fine.
That's why I want my coat on. Okay, thanks.
Okay.
Embarrassment.
Yeah, I'm here for you.
Public embarrassment.
Yeah, there you go.
The numbers today are not the best. They could be a lot better. We seem to be going higher and increasing in our acute infections. Today we have 34 patients in-house, 10 in the ICU, and 6 of those on the ventilator. We still do have 25 who are meeting that acute criteria. after infection, so in that recovery phase. And unfortunately, our partners out west in Hays are also seeing an increase in the numbers too. They actually have 20. 19 of those are active. They had 19 yesterday, but of that 20, one is in that recovery stage as well. So,
I also know that we just completed a CMO call, and the numbers are up in a number of the hospitals around our community, and so it is a concern. I don't think we're in danger in hospital beds, but this is a higher number, and we're entering in that time of the year where people are sicker in general, and hospital census tends to rise. And right now, we have 60-plus patients who are COVID-related in the hospital, and that's a big number. And so something we have to make sure we stay ahead of, and the way to stay ahead of it is to practice great infection control, and nobody's preached that harder or longer than you have, Alan Greiner. How's it going?
That's right. Well, we're seeing an increase as well here in Wyandotte County. We had our peak really in mid-July and have had a decline, which we really think is related to behavior and the mask mandates and people taking up wearing masks all the time and social distancing and just watching what they're doing. But with schools restarting, we think we're still seeing the effects maybe of Labor Day as well. We're seeing a slight increase in our 7-day moving average, and so we're nervous about that, and we're hearing it from around the state as well.
Yeah, it's been a difficult time. Have you seen influenza in Wyandotte? Do you know of that?
We haven't had a case yet.
Okay, that's all I know either. All right. So, Broderick, I do realize that in the 20-plus years that you and I have known each other, I go back a long way. I still had hair then. I'm not sure you did, but I had hair then, and it wasn't the same color as mine is now. So, how are you doing? Tell us what's going on over at New Bethel. Tell us what's going on with the Community Development Corporation.
Well, Dr. Stites, it's a pleasure. Thank you. It's great to see you. Of course, I know your colleague there since he was, I think, a wee fellow in the infectious disease.
Yes, he was. He was a very young man back then.
Yeah, we used to call him D-Hawk back there in those days. And, of course, known Dr. Greiner for a number of years. And I actually know one of your staff members who you are speaking of fondly. Anthony happens to be a member of New Bethel Church, and I've happened to have known Anthony all of his life. So it's a pleasure being able to interact with all of you all. So
Anthony's getting called out today.
Engaged. Yeah, we're very engaged with all things COVID. Here in Wyandotte County, certainly we have a health equity task force that we have partnered with Dr. Greiner and several faith and community leaders to try to address the burden that occurs with COVID here in Wyandotte County, of course, as it has adversely impacted both the Latinx and African American communities and the community as a whole. We have been very successful in creating COVID pop-up sites where we're actually providing testing in church parking lots, in community parking lots, and places that are trusted by the community. So we're very happy with what we've been able to accomplish. And now very quickly, we have been successful in receiving this NIH grant, which I'm sure Dr. Greiner will speak to. And we're just looking forward to being able to share the lessons learned and the great opportunities we've had here in Wyandotte County.
Well, I think that is great news, and that NIH grant is a special deal. So, Alan, talk to us a little bit about that.
So the National Institutes of Health has put a lot of funding into coronavirus and the response. There's, as you know, there are vaccine trials going on with a lot of funding in our region and across the country, but there's also a big effort to improve COVID testing and study methods for enhancing testing in communities. So this proposal is under an umbrella called RADx-UP, which is Rapid Acceleration of Diagnostics for Underserved Populations. So it's specifically intended to fund projects addressing COVID in underserved populations. And because of the great work that Mr. Crawford and a variety of community partners have done in Wyandotte County, getting on top of this issue and working on it, we kind of had a model we thought could be successful and work in other environments, and so we put this grant in just really about 6 weeks ago, And then just heard on Thursday, Friday that we're going to be one of, I think, 32 sites funded to do this work. And we have 9 other county partners across the state. So we have six rural counties that we're working with and 4 urban counties across the state. And we're going to just build a team that we call a learning community that tries to innovate and come up with ideas together that make a difference.
And we need you to make that difference because we know that vaccines historically are not as well received by underrepresented minorities or by even in rural communities. So what are some of the strategies that you all think you can employ to help achieve that?
So Mr. Crawford already mentioned pop-up testing. We think getting out there into the community, in neighborhoods, makes a huge difference in getting folks to come out for testing. We'll be trying things like partnering with workplaces, trying to get in large employer business settings and doing testing in those environments. And then we think doing things like meeting some other needs of folks. So we've been in Wyandotte collecting a lot of info on, what sorts of employment problems people are going to have, whether they have food insecurity issues, and then trying to connect them with resources or provide resources. We've got a whole program, again, that Mr. Crawford and others have been involved in to give folks food who might need it because they're stuck at home for 10 or 14 days.
Yeah, and I think it's a big deal, and vaccination a big deal, and we've had limited success with some of the vaccine trials getting into minority communities because of a historical lack of trust between minority communities and research for some very good reasons. And we know when we started working in healthcare and trying to do more in Wyandotte County here at KU, we went and had a number of different focus groups, and Broderick helped us with some of those, as did New Bethel, and the message was clear. You guys come in, you run some experiments on us, and then you leave, and we don't ever hear from you again. And you know what? That is true, and that is a problem. And one of the things we've tried to do, and family medicine has really helped lead the way for our academic medical center, is to have staying power and do things in Wyandotte that are forever things. And our work with Vibrant Health and an FQHC and everything exemplifies that. But we have to build trust with the minority community and the Hispanic community and the immigrant community and Latino community. We have to build trust because otherwise we won't be successful with vaccination therapy with one of our most vulnerable populations, Broderick. So other thoughts what we can do to help with that?
Yes, absolutely. And as you mentioned, KU has done some great work in Wyandotte County. But as I have shared with you and several other of your colleagues there and throughout the Mets, and the community needs to see you without your white coats. And so how can you continue to participate in community activities? Of course, now with COVID, many of those activities are limited. But for example, Dr. Greiner recently participated with us when we did a Faith Leaders Peaceful Protest, where we had individuals basically not marching, but standing on specific corners protesting what was happening throughout the country. And Dr. Greiner and Dr. Corvo and several members from both KU and the health department were present handing out masks. They were present providing information. They were present being able to answer questions. And so people were able to see them outside of the clinic or outside of the hospital setting, which allowed them to continue to build relationships. What matters to people in this community is relationships. And when you build relationships, you can work through the adversities because you've got rapport with the community. And that's what's so vital and that's what's so important.
Yeah, makes total sense. I think that's true in all of our lives and something we need to do an even better job in Wyandotte. One of the things we want to do is we keep talking about Wyandotte, help tell the story because it's so important now. And if we're going to have an effect throughout our community, we've really got to make sure we improve the health in Wyandotte County. Otherwise, all the efforts around COVID won't be as strong as they should be.
Yep. And listening is important too. You mentioned focus groups. I think we've got to keep our ears open, and sometimes as physicians and a healthcare providing entity, we have a lot of answers, but we need to learn from the community too. So a big part of this new grant and our ongoing work at the health department is going to be, talking to folks, getting out there, doing interviews. We've got some of our other faculty in population health that'll be involved with this project, and they'll be doing a bunch of interviews all over the state, really, to figure out what people are thinking.
That's great. Yeah. We have a lot of answers, but we better make sure we know what the questions are, because otherwise our answers go for naught. Okay, let's see what we've got questions out there from media.
Good morning, guys. Taylor Hemness from Channel 41.
Hey, Taylor.
Hi, Taylor.
So I don't know if you've seen the news this morning, but there's some big news out of the NFL, and it may affect the Patriots, or may affect the Chiefs. One of the Patriots players tested positive today for COVID-19, Stephon Gilmore. We have footage of him hugging Patrick Mahomes at the end of the game the other night. My question this morning, you can tackle as both fans and as doctors, given what we know about the timeline from the fact that this player tested negative before the game on Monday night and now has tested positive 2 days after the game, and his contact with the members of the Chiefs, what would you expect to see, and what would you hope to see the team do today in the next few days to try and mitigate any potential spread or risk and avoid becoming what the Tennessee Titans have become in the last couple of weeks?
Yeah, that's a great question, and I appreciate that. And we're going to try and stay in our lane around this question, and but I will give an answer as a fan. First of all, Stephon Gilmore is one of the finest cornerbacks in the National Football League, and as far as I, as a stand-up guy, and obviously we're all concerned about Patrick Mahomes and the rest of the Chiefs. Brief contact, though, is not how the virus gets spread, and so I think that's less of a concern, but ongoing contact is. The problem with testing is you can, when you have a person that's positive, that story just doesn't play out over 24 or 48 hours on contact tracing DNA. It plays out over a period of days as people can become positive. And even if you're negative one day, it doesn't mean that you're not, and you test positive the next, you don't know when you turn positive, right? You could have started shedding virus at some point. So Stephon Gilmore could have been shedding virus during the game, who knows? And I think that's going to be our challenge as we follow this throughout the NFL or any sports league.
Yeah, absolutely. I think, again, most of these sports leagues have put in place very good protocols, very good systems. They have a lot of resources. They can do daily testing. Without knowing any other information than what you said, I think we just kind of have to wait to see how it plays out over these next couple days, really look at the contact tracing and all the data and all the information. And again, I think with the resources that they have and the protocols they have, and testing frequently is going to be done, especially here in this case as well.
Well, we want the Chiefs and the Patriots and their staffs to be, everybody to stay healthy and to stay well. But this thing about contact tracing is just real, as you know, Alan, because again, you're negative one moment and positive the next. What point did you become positive, and who were your contacts? And then it can take those contacts up to 2 weeks to turn positive. So
that's right.
If you were looking at this as a public health question, how would you look at it?
Well, we typically go back 48 hours before someone has a positive test or before somebody has symptom onset, and think of that 48 hours before that as a potential time when they might be shedding virus. But again, like you said, brief contact is not typically the way this virus is spread. We usually look at, at that close contact for cumulative minutes. There's even some controversy about how many minutes, though. CDC is talking about 15 minutes of close contact. Here in the state of Kansas, most of us are using a 10-minute close contact rule. But it's really tough to define. But we just try to work with our citizens when we get a hold of them and talk to them about this to make sure they're safe, and to try to get everybody that, especially in their families or coworkers, get those folks to stay home for the 14 days from the time of that close contact.
Yeah, that's right. And I think the good news is that if Stephon Gilmore was negative on the game day and then negative on Monday, I don't know if he was negative on Monday, but assuming, let's say he was negative Sunday, negative Monday, he probably didn't shed it Sunday night. And if he turned positive, yesterday, then okay, between Monday and Tuesday he turned positive. That'll be I have my days all off by one, but you know what I'm trying to say. If he was negative Monday and then he was negative Tuesday, Tuesday. It just depends on when he turned positive, right? We just don't know, and that'll be the real key, and hopefully the spread will be minimal. But that's the problem. If you really got to kind of let those play out, I think what the Titans ended up doing, which is waiting really 14 days and for a series of negative tests and for it to kind of the new test to die off, that makes a lot of sense to me, and I suspect something like that's going to have to go on here. So, okay.
Other media?
Yeah, other media. All right, Jill.
Okay, well, the first question comes from Leanne, who wants to know why Dr. Greiner with the Wyandotte County Health Department did not get a flu shot this morning. And I just want to publicly say that's my fault.
He said, yeah.
I didn't tell him. I didn't warn him. Have you had
No,
yours?
I have. I've had mine. We did a blitz at the health department on Friday, and our vaccine nurse, Charlotte, went all over the building and got us all. So I had mine on Friday, and we will be offering more at the health department and with pop-up sites. Just like our COVID testing, we're going to be doing a lot of pop-up flu vaccination this year, too. So we'll have more info on that in the coming weeks.
And just to say, Wyandotte County has done a great job around these pop-up COVID swab clinics and things designed to try and make sure you reach into the community. You didn't just wait for the community to come to y'all. You guys went out and partnered in the community and had lots of activity to try and make sure everybody had an opportunity.
Yeah, it's been real successful. We've had great community support. It's hard to do that stuff when you need to borrow somebody's parking lot. We've tried to rotate sites around and then go back to some of the same sites as well. We're also going to be doing things in schools. We've got I know lots of people are working on saliva testing. We're working with a partner that's got something into the FDA that we hope will be able to test symptomatic kids in schools in the coming weeks. We're training up nurses in schools. We're getting them fit tested with the proper PPE and stuff to work with the school districts, and we hope that's just another way we can be out there and not having to expect people to get to us either at the health department or get to us over here at the health system.
Broderick, what do you think has been most important, and what will be most important for making sure that people in the community get their flu shots?
So I think exactly what you have done. So modeling behavior. One of the things that we've asked all of our faith leaders, our pastors and clergy to do is model behavior. And as they are getting their flu shots, their congregations will typically follow suit. Again, as Dr. Greiner mentioned, having it available at those pop-up testing sites where folks can also get the flu shots, taking the communication, taking the education, take the actual services to where the people are. You have a lot of folks that just are uncomfortable with getting out, and those that are getting out sometimes don't understand the importance of PPE. So as we can better provide those services to them in the community settings, it will, I think, in the long run, help the county as a whole. As you know, we've always had a challenge with where we stand with our health rankings, but this is one of the ways that we can help to combat that, to make sure that people in Wyandotte County are receiving the services that they need and understanding why they need those services.
All right, Mary Lee is in her 60s, and she wants to know, is it safe to get on a plane and go fly to see the grandchildren now that the middle seats are open? She talks about that their family is in a bubble, and it's been limited to other families, and one grandchild is now in school. If not now, she wants to know when.
When will it be safe?
When
will it be safe? Okay, Hawk, that's a different kind of question. Yeah. You and I have both said that, you know, it's all about risk and how much risk you're willing to entertain. Flying is a risk, and mixing bubbles is a risk. I have chosen not to do that. You flew some earlier then, but I've been a little more reluctant now, I think, because of the increased spread of it. But when do you think it would be safe, and what precautions can people take?
You know, I think this virus is going to be here with us for a little while.
Yeah.
There are new trials on new therapeutics. There's obviously trials in the vaccines. It's a very difficult question. I did send out a recent article to my colleagues about, it was from JAMA Internal Medicine, I believe, about the flight itself and how airflow does go down and then down through the bottom. It doesn't really transfer through the plane itself. So flying, as far as that way goes, if you can use eye protection and a mask, you should be fairly safe. But it's all about risk reduction too. It's a difficult time to understand when it's going to, because now we know that we are seeing surges in Europe. We are seeing more cases here in the United States as well. And so if cases are continuing to go, you have to understand that that risk, no matter where you go, is going to be higher. And then I think more importantly, to your point, the mixing of the bubbles, because it is out in the community more than it was. So I think that's really the important thing. It's hard to tell exactly when. We kind of addressed this a little bit yesterday with the Thanksgiving theme and all that kind of issues about mixing bubbles and having people. It's very difficult to predict when, but all we can say is that we know right now, again, in Europe, here we know that cases are on the rise.
Yeah, and I think the more crowded the plane, if you're sitting right next to somebody, you're going to be in their bubble. Let's say that plane's an hour and a half flight. Even with a mask on, you're going to have a little bit. I mean, it helps that both have masks.
Yeah.
But if that person's mask keeps slipping below their nose or doing things, you're just going to enter in a little more risk. You just have to be willing to accept that risk to fly. The question, when will it be safe? And it be safe is when we have vaccination for COVID, the virus begins to dissipate, go away, and we have effective monoclonal antibody therapy or other measures that we can use. And I think that'll make it safer. But in the interim, flying has a higher risk. It just does. And there are things you can do to mitigate it and make it less safe. make it safer. But it's not as safe as driving. It just can't be because of the dynamics of it. Not to mention you have to go through the airport, Alan.
Yeah, so there's lots of risk there. I have heard people talking about when they're going to be visiting family, getting both groups tested. None of us can test as much as the NFL, right? But we do have more available testing. We're doing asymptomatic testing now in Wyandotte County, both at our pop-up sites and at the health department. We really saw kind of a drop-off in testing there for a little bit, but that's helped us get our testing numbers up a little bit more. And so we think maybe in a situation like this, everybody ought to get tested if they can, the day before a visit. That's another way just to potentially mitigate risk. But
I think that's a very good point. And as we get further into this with diagnostics, particularly more accessible or even home diagnostics tests, essentially, that may become a lot easier. There was a recent opinion by Paul Sachs in the New England Journal of Medicine about that theory and about the frequent testing and the cheap testing. So $1 to $5 per test, but do you get a case of them to be at home where they can be easily administered and they can give you a rapid result? If it's negative, are you surely negative, or is it because you just don't have enough virus to be infectious at that point? So that is one of the other theories out there. Certainly there are plenty of companies out there trying to look for rapid home diagnostics, and maybe we'll get to that point as well.
Janet wants to know if we contact trace employees if they test positive, and how far back do we go?
You bet, Hawk.
Gosh, we do test. We have tested. I don't remember the total number. We've basically contact traced just about every employee who has become positive here at the health system. Initially, the CDC said 10 days, but just as Dr. Greiner said, that did get a little bit too cumbersome, so it is 48 hours from your symptom onset. But we have traced, and again, we've done it for, I think, at least over 1,000 employees or something. 1,000, yeah. And most all of those were obviously community onset and spread. So we actually we have a very good team in our health system to contact trace our employees.
Julie says she has a friend whose husband tested positive for COVID, but he never got it. Why is that? They live in the same house.
Yeah, the truth is that even without household contact, the data from China, that only about 15 or 20% of people get it, and that's a difficult bubble. So it's not guaranteed that you're going to get it. The dynamics of this infection spread, we know, are droplet, and some people use the term aerosol, but it's not. Be careful, it's not measles, it's not tuberculosis. If it is aerosol, it's still kind of aerosolized droplets that hang a little longer. But the reality is that it's not 100%. There are a lot of things that are operative around that, and why that is, we don't really understand. It's funny, because if you said this about measles and you walked into a room where somebody's breathing out and was infectious with measles, you're going to get the measles. TB, you're probably going to get TB, or not 100%, but it's much more likely.
Yeah.
But this one, this one's just different, Dana.
It is different. And we even had Anil on for an anecdote. And I thought he was sitting on the couch when he was super ill before he went to the hospital, with somebody sitting on the other side of the couch, and they didn't get it. So, but to your point, there has actually been a plethora of household contact tracing and attack rate publications, and it's about 5 to 30%, but I think the best place to land, just as you said, Steve, is about 15 to 20% secondary attack rate within the household. Some of that is males less than females, but they didn't know if, because some of those were the fathers, so they were at work maybe more, maybe not spending as much time with the kids, things of that nature. They weren't having that close contact as much as possible, and certainly spreading to the kids seem to be a little bit less as well. But to your point, in general, the household attack rates do seem to be about 15 to 20%.
Yeah, it's funny out there. Okay.
Louise, she's in her 80s. Her grandchild is coming home for college at Thanksgiving. She wants to see the grandchildren and have people over. She said it's only 4.
Yeah. Well, it's not the number, it's the situation, and so we're mixing bubbles with that one a little bit, Alan, and I think all families are trying to figure this out, and the answer is, it's not, is it less safe? Of course it's less safe. People coming in, it's a grandchild, you're 80 years old, is it less safe? Yes. Is it so less safe that you're not willing to take the risk? That is a personal question. It's really not a medical question. We'll tell you that it's less safe, but you're going to have to decide whether or not you're comfortable with it. So, Alan, thoughts?
Yeah. I mean, again, I think it's about thinking about risk and thinking about mitigation, things that could be done where you're spacing each other out. I mean, maybe hugging isn't the best idea this Thanksgiving, and maybe people ought to even be wearing masks if they're going to be in the same room. It'd be great if we could keep doing things outdoors, because we really have seen decreased spread when people do things together outdoors. But that's going to be tougher with the weather getting cold, and that's what worries us too.
It does. Broderick, what are you going to do for Thanksgiving?
So I haven't actually made plans just yet, but certainly what each of you have said is a part of the concern for our family. My mom is 78 years old, and certainly we all want to be around Mom, but my mom has been previously positive, and she's doing well now. But again, we don't want to see a repeat of that. And so we as a family are going to be very cautious in what we do, and we're sharing that with our relatives, that this is not a time to be macho and being able to talk with someone, see someone at a distance will be okay this year. I'd rather not hug or not be intimately close with a relative and we both live than to do the opposite and someone falls to something that could be fatal. So you got to weigh what's of more value, that family member living longer or just a quick 5-minute hug. We've got to understand as community that it's more important to value life versus a emotional moment.
Al, Broderick, that's the best I've heard anybody say it. We're going to line up you and Anil to just do the show, because Anil Goldmacher yesterday had a great comment about virus and fear, and what you've just said is just spot on, I think.
And I think especially whoever it is, whether it's a college age or even older, if they can maybe be vigilant for 2 weeks prior to coming home to make sure they aren't interacting with people. It's a little bit tougher if you're living in a dormitory style or fraternity house or something of that nature, as compared to if you're living on off campus in a single apartment or maybe with one roommate. Can those people be vigilant and create a 2-week quarantine prior to coming home to really reduce the risk of them getting it? Because we know it's happening. We had a great guest on yesterday who talked about in her family. I know a family that a person came home from college because they wanted to see grandma, but an aunt ended up getting it, a cousin ended up getting it, things of that nature. So I think if you can take those steps prior to the holiday as well, that may help reduce your risk.
We know that there are public events that then dictate what happens to the viral spread, right? We know that that Sturgis or the Big Lake of the Ozarks motorcycle rally or other events, the Rose Garden, right? That leads to more people being positive because those are large gatherings. We know that Labor Day was that. We know that schools opening is impacting our numbers right now. We know that. We know colleges opening have impacted numbers. And I think the next things we have to be concerned about are cold weather as people get moved indoors and still want to be in contact with others. Thanksgiving, Christmas. Those are going to be big points because we all have traditions. Our tradition is we have 25 or 30 people over at the house. We have to change the tradition this year because that's a lot of people. It was mixing a whole bunch of bubbles. And the problem is you don't ever know who's going to be okay with the virus and who's not. And then it's just a gamble. We know what the statistics tell us. The older you are, the more likely you are to be the not. You know, I'm 60 and I have some mild prostate cancer. Okay, so I'm a little more likely to be not. But I'm also otherwise pretty darn healthy, so maybe I'll be okay. But see, the problem is right there. I got a maybe this and I got a maybe that. And what I'm trying to do is build a logic to allow me to do what I want to do or what I've done in the past. But it's all full of maybes. The best thing to do is wait till next year, because I don't think that's going to be a maybe, and you want to be here for that. So what Broderick said.
Magda says that we talk a lot about death in the community and nationally. She wonders, does anybody die at the University of Kansas Health System, or do we just not talk about it?
Oh, you know, we actually talk about it a lot, and we apologize that listener, if they'll go back and look at our log, we've talked a bunch about it, and we don't do it on a daily basis, but I think we're up around 70 deaths altogether. Our death rate runs about 7 to 8%. And periodically, about every several weeks, we go through our numbers that we have, and we break it down by race and age and sex and all that. And we'll be doing that again in a future program. But no, we do try to talk about it. We're very forward-facing around that information. We think the more people talk about that, the better off we are, because what you're going to find out is, yeah, older folks are more at risk, but we've got young people dying, young healthy people who have died or have been very injured so that their lives will never be the same. You know, last time I think we did it, we told the story of the 4 patients, 2 of whom were young. One of whom was an athlete in high school, 19 years old, and that person survived but has a severe heart condition and you know, may come to heart transplant at some point, is not doing all that well. There's a mid-20-year-old who developed pneumonia in the lung from COVID and ended up having to have part of her lung resected. She will never breathe the same again. I mean, there's a 35-year-old who we've lost. There's a 50. I mean, this goes on because COVID is real, Alan, and it's got to be real in the community you work into.
It is, yeah, and you know, I think it's eventually. I think we're all going to know people. I had a patient that I lost from complications that was here, right? I think it's going to happen, and 7% of those that get admitted, right? You mentioned in the community in Wyandotte, you know, our death rate's about 2% of. We don't know what the fatality rate truly is. I don't think.
Well, we don't know the total.
We're not catching, right? Because we're not catching all the cases.
Right.
But thinking about a 1 or 2% death rate from a condition, that's
high.
Pretty darn high, and nobody wants to take that gamble every morning when you get up. I have a 1 in 100 chance of dying from something, and we are seeing it in younger people. The age range of those that are getting it and that are getting hospitalized, as you guys know, is going down, and there are going to be lots of people with lifelong complications that I don't think we're getting the word out about that very well.
I think we're so focused on death, we don't talk about.
We've got to talk about heart and lung problems that are going to be long term, and how we're going to handle that as a country and as a healthcare system.
And Broderick, you in your congregation, have you had some people who have died or passed away from COVID-19? Do you know anyone?
We haven't had anyone directly in the congregation that has died, but we've had many ancillary members of families. So we've had a lot of family members who have died who are relatives of members of the church. We are very focused in what we do there at New Bethel. We're making sure. So, for example, we've not gone back inside since early March. We have drive-in services, and we do live stream where folks aren't getting out of their cars. And if they do to go to the restroom, they're wearing masks. So we're very vigilant about our safety protocols there at the church, because it's important for us, again, to keep members alive as opposed to emotional moments. And we're trying to help members and our community to understand that health is better. Making sure you have good health is more important than an emotional moment, because you can have many opportunities for future emotional moments. You only have one life, and it is very important to protect every aspect of health to preserve that one life.
And I think to Alan's point too, we truly don't know what the mortality rate is. We believe the case fatality rate, meaning the diagnosed cases that we have who die, the case fatality rate is probably around 3 to 4%. I think that's where Johns Hopkins is kind of bouncing into. The infection fatality rate, meaning all of the infections, and again, some of those we don't know about, tends to be about 0.5 to 1%. And then for influenza, it's 0.05. So that's almost 20 times more. And I think I saw a headline the other day that the deaths from COVID right now that we've had, and again, not even a full year, are more than 5 years of influenza. So.
Yeah, I think it's, well, we lose 30 to 40,000 people a year to influenza, and this 6-month period we've lost 210,000 thus far to COVID-19. So yeah, it's not even close. I mean, those of you who say it's a hoax or it's no, that's wrong. It's not even close. It is not influenza. It's not even close. Jill.
Andy has a related question. She wants to know, is it true that most everyone who goes on a ventilator dies?
Yeah, that's a great question, and the problem with the answer is it's imperfect answer because we have changed so much how we have treated people on ventilators, even how early we put people on ventilators. Initially, we were putting everybody on a ventilator early so they didn't spread the virus. We realized that turned out not to work as much, and we could do other things to keep folks safe. We're using different forms of trying to keep people off ventilators. The numbers aren't really comparable, but it's probably somewhere in the 30 or 40% range of people who go on ventilators pass away. Which I'll just tell you, from a pulmonology standpoint, that's a high percentage in an illness. So you don't want to be on a ventilator, but it's a sign of a lot of destruction and underlying disease in your lung that because of the virus, and whether or not your body has the chance to recover from that is key. And we know after about 14 days, if you're still on the ventilator from COVID, then the numbers and your likelihood of passing or dying from that tend to go up a lot. And so, I think what we're doing now is everything we can to keep people off ventilators. I don't know if
Yeah, absolutely. I agree with you. I don't think we know. I think it was different early. Especially from the reported Chinese experience and the Italian experience from what we are doing now. And to your point, even those that don't die, if you are on a long time, you probably need a tracheostomy, meaning you need a tube in your neck to help you breathe because you're going to be on that ventilator a long time in an effort to eventually wean you off. So there are other complications, and that is one of the other complications we've been talking about. Even if you don't die, there are long-lasting effects.
Last question.
Okay, because there's tons here, but KCK, Cindy wants to know, what is your thought about KCK reopening schools?
Well, we've got some schools open already in Wyandotte County. Bonner Springs, Piper, the Turner districts have all come in with plans that we worked with them to develop and approve. They're trying to use what we call a 50% density model. Mm-hmm. So they've got 50% less kids in the same physical space they would typically have. And that seems to have worked pretty well. We've got kids in schools that have had cases, but we don't have any evidence of spread between kids that's happened in schools. So we're pretty happy with that. We're very nervous about the idea of more density of kids where they can't keep 6 feet of distance from each other, where they're moving from class to class. We're hoping that we don't have to move to that anytime soon with the numbers we're seeing. Our biggest district, USD 500, is not open yet, but we'll probably come in with a similar plan. So we think it can be done safely, but it takes a lot of planning and a lot of care and a ton of effort. So we're trying to work really closely with the districts.
All right, Broderick, final thoughts for today.
Well, as we talk about the number of cases that we've had and the number of deaths we've had from COVID, for a few of us that are old enough to remember the Vietnam War, in 10 years, we lost about 50,000 people. In 6 to 8 months, we've almost tripled and sometimes quadrupled that number. So when you look in comparison of 10 years versus 6 to 8 months and the number of deaths associated to those two periods, we have to be vigilant. We have to use all of the safety protocols. We must do everything that is necessary for us to do to preserve life in this county, in this state, and in this country.
Thank you, Broderick. Beautifully said. Alan?
Well, yeah, and I think we've all been working on a new normal, establishing new behaviors, but like we've been talking about as well, let's keep getting tested if we think we need to. Let's get our flu shots. Let's have a safe fall and winter and do things differently this year so that hopefully we can get back to normal life once we have the vaccine down the road.
Yeah, I just really like to say, Broderick, he's like a bad penny. He always turns up. I tend to see him once or twice a year. He was very important in my formative years with infectious disease. Him and Dr. Hinthorn really kept everything running smooth, and once Broderick gets a hold of it, you can be assured it will be running smooth. His heart is in the right place, and it's just very good to see you again. Thank you.
Likewise.
And Broderick, as always, it's a pleasure. Alan, it's always a pleasure. Thank you guys. And thank you all for the great work that you do. It is just, I can't tell you how important that is. Hey, tomorrow, pediatric specialist Dr. Stephen Lauer and Dr. Danielle Johnson return to our update about how the change in seasons can result in a change in mood for kids who are already being buffered by this pandemic. The doctors will talk about who's at risk, how to spot those signs, and offer advice on coping, plus what they're hearing in their clinics from kids and how we're doing with the virus in children. 5 employees of the KCK Board of Public Utilities were injured back in May during an explosion, and they are among some people trying to do good work. They were treated at the Burnett Burn Center here at the hospital, and when they got out during a pandemic, they helped raise $3,200 to purchase better razors for the center. The razors help clean the burn wounds and are used to shave hair to reduce the risk of infection. I do want to say they are all masked up. Well done. They're all showing their masculinity. Please remember, we want to see how you are going to incorporate your mask for Halloween. Give us a shout out here. And yes, we still owe you a song about 50 ways to love your mask. We haven't forgotten about that. I want to thank everybody for tuning in today. Our best wishes to the Chiefs and to the Patriots and to everybody out there who has been suffered or is suffering or knows people who have suffered from the virus. There are people who still don't believe in it, but it is so dadgum real. Just remember, experience may be the best teacher, but only a fool will learn from no other. Let's not get fooled. Stay safe out there. We'll see you tomorrow.